Welcome back. Hospitals across the nation are navigating a critical shortage of blood vials used for diagnostic tests. The CDC announced the shortage in early June, but issued a new warning yesterday.
Health officials say the shortage is impacting the quality of patient care. 6 News' Johan Marin is on your side tonight with how local hospitals are navigating this situation.
There's a national shortage of blood vials, the small bottles used by hospitals to store blood,
in which we take blood from patients to look for infections, particularly bacteria growing in the blood. The shortage means that we do not have the same capacity and are at risk to not be able to perform that standard test.
Dr. Kelly Cockett tells me patients who often need these tests are showing signs of a bacteria infection, known as sepsis, that often comes with flu-like symptoms. And those at risk are usually adults older than 65, and those with a weak immune system or chronic condition.
We've been able to maintain a supply to continue to provide that standard of care for our patients, but are constantly working to minimize any excess waste of those bottles and make sure that all of the bottles are used appropriately to continue to provide that excellent standard of care here at Nebraska Medicine.
Cockett says they've decreased their use of blood vials by 30%.
Looking at multiple different ways to continue to do blood cultures if we are unable to get more bottles at some point during this shortage.
CHI Health and Methodist Health Systems say they are not impacted, but Methodist is taking preventive measures, telling 6 News, quote, "We are aware and have worked collaboratively with our infectious disease team over the last few weeks to provide blood culture utilization guidance while ensuring patient care standards," end quote. While Nebraska Medicine says the shortage is impacting their operations, it's not impacting patient care.
We have been making changes since early July here. It is not something in which I would want patients to feel like they cannot come to our clinics or come to our hospitals because they can't get a test they need.
Other hospitals I've reached out to were Children's Nebraska and Madonna Rehabilitation Center. They tell me the shortage did not impact their operations. On your side in the studio, Johan Marin, 6 News.